Is upper eyelid blepharoplasty painful? Generally, this is a very non-painful procedure that patients can usually get performed with a minimal amount of postoperative pain medicine. Because the procedure is very mild and is almost like a skin excision, and the eyelid is not particularly painful, it may swell and bruise a lot, but it is not very painful. Many of my patients don't even take any narcotics after surgery. They only take acetaminophen or Tylenol. We often give them a prescription for narcotic pain medicine, such as hydrocodone, but they usually do not have to take it. And if they do, they might only take it the evening of surgery and likely not the next day. What is done in an upper eyelid blepharoplasty? It's, for me, a relatively simple procedure. It involves an incision that is in the upper eyelid crease, and we remove skin above the crease, the redundant skin that makes the eyelid look heavy and aged or tired. If the patient has a lot of excess fat, they have very full lids, and this is a minority of my patients, we sometimes will take a little bit of fat out. But in my practice, it's uncommon that I take much fat out of the upper eyelid. So in an upper eyelid blepharoplasty, I am usually removing a little skin above the upper eyelid crease. I commonly do not take fat out of the upper eyelid because that makes the eyelid look more hollow, and that actually ages the upper eyelid if too much fat is removed. What I do commonly do is raise the level of the eyelid. Realize that people think that their eyelid looks heavy when it has extra skin, and they think that their eyelid looks heavy when the lid itself is droopy. I tell patients, this is like the window shade coming down on the window. So it may be one or the other, or often both of those that I'm correcting. And that opens the aperture of the eye a little bit, and it removes the redundant or excess skin. How long does it take to recover from an upper eyelid blepharoplasty or upper eyelid lift? Because this is really pretty minor surgery, people recover from it pretty quickly. The one thing that can happen is eyelid surgery is done on very thin skin of the upper eyelid, and that can cause us to swell and even bruise a little bit. And sometimes the bruising is down in the cheek where we haven't even worked. In other words, the bruising and the swelling go south of where we've done the operating. So that adds to the recovery because people don't look perfect. I think to look generally good from eyelid surgery takes about a week. Sutures are removed in about 5 days, and it takes about a week to look good, not great. It takes about a month to look great, but most of my patients are doing 95% of what they normally do 5 to 7 days after the eyelid surgery. How much does an upper eyelid blepharoplasty cost? Well, that, of course, depends on the surgeon, the region, etc. A lot of factors in that. But as a general rule, $3,500 would be in the inexpensive side, and $6,000 or $6,500 would be on the expensive side. My prices are a little more in the middle of that, about $4,500 to do upper eyelid surgery. If you have questions about this pretty minor surgery, which can be done alone or with many other things, call me, email me, call or email my office. I'd love to hear from you, and I look forward to seeing you in my office, at which time we diagnose the exact thing that you don't like, and I try and fit that to my surgery. Thanks very much for watching.